This is my reflective journal entry for management of the third stage of labor, which is the delivery of the placenta. I have been at over 50 births in the last 6 months, so I've been able to see a lot. And depending on the midwife who I've been with, it's managed differently. And I feel like the biggest thing that I've learned in all of this is to know the client's history. If they've had babies before, do they have a history of postpartum hemorrhage? Also, are they anemic? Have they been anemic at any time in their pregnancy? And it might be managed differently. For one client, nobody asked her during her prenatal care what her previous births were like. And somebody told me once upon a time that if something like pops into your mind in the birth space, like channel that intuition and go with it. And don't like tuck that away when something pops into your mind. And I was in our supply closet in her room while she's laboring, and I just saw IV supplies and a saline lock, and I was like, "Hey, did you bleed with your last babies?" And she was like, "Yeah, I hemorrhaged with both." And I was like, that's not written in your chart." So we just decided to set her up with a saline lock at that time, and just keep it in place by the time she delivered. She delivered in the tub, and within 2 minutes of birth, there was probably 500 mils of blood in the tub. Quickly got her out, quickly got her Pitocin intramuscularly, and then Pitocin in her IV, and we were really glad that we didn't have to set all that up while she's bleeding and we're taking care of baby. So that went really well. When it comes to clients and their wishes for how the third stage is managed, I feel like I'm seeing this a lot more where clients are not wanting that gentle guidance of their placenta outside of their vaginal canal. It's important to have open communication with a parent about what we're seeing, because they might be feeling some different things, but they're not seeing what we're seeing. So, we can tell them, if you feel that blood coming out, that's the separation gush of your placenta detaching from the wall of your uterus. That's a sign that your placenta is ready to come out. If you feel like you need to bear down at all, do that, and I will help guide your placenta out of your body if it's willing to come. I was in a situation a couple weeks ago at a birth, and my preceptor had me getting the placenta out, and it just didn't want to come. Mom was flat on her back too, which doesn't help at all. And I have one finger inside kind of guiding it along, and I can feel kind of where it's attaching to the placenta, but it still feels kind of far. But it was a little while, probably 10 minutes after the separation gush, and I'm pulling it along, and the cord is lengthening, like all the right signs, but I can feel the cord start to give, like, and ugh, that feeling just creeps me out. I did not like it, and so I told my preceptor, I'm like, this cord just like wants to snap, and she told me to just go in and get it with my hand, and it was detached. It was up near the cervix though, kind of half in, half out. And I did go in with my hand and just manually pulled it out. I mean, it was detached. It was just there. She didn't bleed a lot, but that was a new experience for me. Of course, parents hate that, and this client really was not a fan of what I did to get her placenta out. My preceptor sort of rushed me in that situation, rushed the situation without offering any time to talk to this client about what she wanted. Anyway, so I've been mulling over how that could have been done differently. But when it comes to our case studies and our clients, it's important to monitor bleeding and to be accurate with our estimates of blood loss. In the third stage, there can be a lot of blood loss, like with the separation gush, and then from what I've seen, after the placenta comes, usually there's another gush that sometimes comes behind that. And having a protocol in place for how much is too much is good to have. The midwives that I work with right now, they all kind of have different philosophies on how to manage that, and kind of on a case by case basis, depending on what the parents' wishes are. But we do not use herbs for managing the third stage unless the parents have bought them themselves and wish for us to use them in any way. But we have the parents administer them themselves instead of us doing it for them. Anyway, so I'm still deciding on what style works best, but what I see in the practice that I'm at now is a mixed management style, which we will use Pitocin at a certain point, but generally we just wait for signs of the placenta separating, and then we help the placenta out with gentle guidance. And so far, so good. I think my inclination is to be a little more hands off. But different situations, different clients warrant different management styles. So anyway, this is my reflection on the third stage. All right.